You've heard the promises of the weight loss revolution, but have you heard the warnings? People are achieving incredible results with GLP-1 medications, but the rapid weight loss sometimes comes with unintended aesthetic consequences, including the dreaded Ozempic Face, sagging skin, and body contour changes. Is this inevitable or can it be managed? Hold the needle. Today, we're cutting through the noise. We're joined by Robert Manzo of Skinprint and Morgan Alexander, our Integrative Weight Loss Specialist, to separate the myths from the truths about rapid volume loss. We'll reveal the exact protocols from breakthrough skincare technology to non-surgical and surgical tightening that can correct these changes and keep your skin firm and healthy. Stay tuned for the definitive guide you need before, during, and after GLP-1 therapy.
Welcome to the Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Garrett Harper Cosmetic Surgery in Charlotte, North Carolina, the Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper and Dr. Evon Zoog, also known as the Doc Dudes.
Welcome to the Doc Dudes. I am Dr. Garrett Harper, joined by Dr. Evon Zoog, both board-certified plastic surgeons. Today, we are excited to have two special guests. The first is Robert Manzo, founder and president of Skinprint, which is a medical-grade skincare line that has been really at the forefront of breakthrough technologies in skincare management and just therapies for forever. And Bob's one of the smartest guys you're ever going to meet. So we look forward to kind of hearing not only his personal story, right, about GLP-1s, but also kind of how he's taken his business to the next level to address a lot of the problems that we might see with rapid weight loss with GLP-1 therapies. We also have our very own Morgan Alexander. She is in charge of our integrative weight loss management. She is our specialist. She has taken all the courses. She's so smart. We're going to quiz her on so many things and try to stump her. And she just turned bright red. So she is not wanting us to do that. Say hi, Morgan.
Hi, everybody.
Yeah. All right. So we're going to start off today just, like maybe the audience doesn't know what the heck a GLP-1 is, right? I am going to ask you to define a GLP-1. Like, what the heck? When people say GLP-1s, I'm on a GLP-1, what does that even stand for and what does it mean?
So a GLP-1 is a glucagon-like peptide. Our body produces this hormone naturally in the gut. So a GLP-1 medication is bioidentical to what your body's already producing. It's produced in our intestines and plays a huge role in regulating our blood sugar levels, appetite, and it actually was used previously to treat diabetes, but with the huge improvement in blood sugar control, obesity, and suppressing the appetite, we've seen obviously huge changes in weight loss. I
mean, was I kidding when I said how smart she was? Did you see that?
She nailed it.
I mean, you're not even like reading. I'm like, dang, that's awesome. Good job. All right. So it's like analogous to insulin, right? Like when a diabetic takes insulin, your body makes it. It's like when we use fillers, like hyaluronic acid, your body makes that. So when people are talking about, I don't know, you're injecting some substance in me, I'm like, you're making it.
Right.
We kind of have a joke on the surgical side when patients say that they are allergic to epinephrine.
Yeah.
You're like, oh man, does it make your heart race? Like, what does it do? So in any event, okay, so this is a product that your body makes. It is a peptide, obviously. And then, we've talked about from a standpoint of weight loss, this is an ever-changing, ever-evolving area of medicine. Obviously, all of these pharmaceutical companies realized that this was taken off like crazy, right? And the answer to 99 questions out of 100 is money. So they see how lucrative this business is. Now everybody's after it. And the good thing about that, right, is that it's just going to elevate everybody's game, right? So we started kind of with the first generation, the semaglutides, right? And so from that, those GLP-1s really kind of only worked through one transmitter, one kind of protein, peptide, that kind of thing. And then as we've kind of moved on to the Zepbound, right? That was kind of like the Ozempics and stuff, right? So then you kind of jump on to the Zepbound, which is the tirzepatide. And then it works through two different mechanisms. And then on the, coming up, you hear about the triple G that's coming up even, right around the corner. And so it's going to work through three different kind of peptides to try to always shoot for having the greatest weight loss with as little side effects as possible. So that's, I was sent out. I was lucky enough to be asked to be on an advisory board for a company. And so it was a nice trip to Newport Beach, California, which was great. And so we're just kind of sitting there and they're asking like, well, design the ideal drug. And we're like, that's pretty simple. Right? People want to lose weight. They want to lose it as simply as possible in like a schedule that's convenient for them. And then they want as few side effects as possible. It's like any medication, right? Mm-hmm. So, all right. So that's kind of the trajectory of where GLP-1s, there's also other hormones. There's other receptors. There's other peptides that companies are looking at that aren't even in the GLP-1 class, right? And so, I can't talk about them too much because I signed an NDA on something, but just know that like everybody is working on this. And so ultimately, hopefully, this gets to be even simpler for people. You and I thought it was a big deal, right? When we were able to offer our patients oral oral preparations of this just for the patient who maybe doesn't want to give themselves an injection every week, or you have a lot of out-of-town patients. And so I know you offer doing the injection for the patient themselves, but, somebody who lives in West Virginia or Florida who comes and sees you, it's a little harder for them to do that, right? So just more convenient, but we just want to make sure that the efficacy of the oral preparation is as good as the injectable, which that's pretty hard to match, right? So
injection is the best.
Yeah. And so I kind of, just a personal story, I can tell you that, I had a family member who was diabetic and was placed on one of these medications. And that person, I won't name that person in case they get mad at me, really just started losing weight. And I was like, dang, like you look awesome. Wow. And so that's how they found it. Like that it worked with this, right? These patients were losing a ton of weight and their diabetes, their hemoglobin A1C was getting corrected and their insulin levels were better. And so it's really kind of interesting. It's almost like, people talk about how Latisse really got founded, right? And it wasn't to grow eyelashes. It was, for actual eye drops. And that was kind of a side effect of it. So, I saw it from the get-go years ago and was like, wow, that's pretty neat. And then, maybe 3 or 4 years when it was crazy expensive. I mean, people were paying $1,500 a month, $2,000 a month to get these preparations. I had the opportunity to try it myself and did, and lost that kind of 15 pounds that I wanted to lose, and felt great. And it was super easy to do. I felt, I'll ask Evan to kind of tell me, you went on it for a second. And so what's your story and what have you seen kind of with your own personal health?
The Zepbound, I actually tried Ozempic a couple of years ago. Didn't like it. Side effects, nausea. And the Zepbound was much better. And I just wanted to try it because I know half my patients are on it. So I wanted to see. And I wanted to lose about 20 pounds, did that in about 6 weeks and didn't even wean off it because I wasn't really on a high dose. Yeah. And the coolest thing to me about these medications is how it just changes your relationship with food. Yeah. Yeah. And because I'm always thinking about what I'm going to eat next. Yep. And you don't think like that. And even since I've been off of it for, I don't know, the last couple months, still that relationship has changed. Yeah. It's really interesting.
That's neat. I felt really good. Morgan, you can share with the audience a couple of weeks ago when I said that we needed to order lunch and you said, what do you want? And I said, McDonald's. Do you want to tell the audience how sweet you were and what you said to me?
We need to make better choices, Dr. Harper.
No, I think what you said was, are you not taking your shot regularly? Has your medicine weaned off?
Your
What'd you say?
tirzepatide has worn off.
That's
clearly,
exactly right. Clearly it had. But no, I mean, they got.
That's our goal, though. We want to help you just form better health habits and make those better choices for sure.
Yeah, 100%. And this just makes it easier. And I feel like this is kind of a poor man's way of saying it, but I just feel like it's a cheat code, right? Because I feel like you're less snacky. I feel like, I don't know, you just don't have the urge to eat as much as maybe, and we all, especially doctors and nurses, we have the worst eating habits ever, right? Because you're just used to like, oh man, when do I have 10 minutes? And all of a sudden you're getting ready to start a surgery at 11 o'clock and it's going to be a 3 or 4 hour surgery. And you're like, well, I'm not gonna be able to eat till 3 p.m. So, you're eating at 10:30 and you're stuffing your face with whatever before you go back there and stand and do all that kind of stuff. So this has certainly helped that. I mean, from my standpoint, same kind of thing, right? Like went on it, lost probably 15 pounds, feel great. I do think that there's some things we'll talk about as far as maybe trying to mitigate some of the things like loss of muscle mass.
There's a right and a wrong way to do it.
100%. And that's what's so great about what Morgan does is that Morgan doesn't let you do the wrong way. If you listen to her and if you follow her instructions. I mean, we all, listen, we've all had parents that have given us advice. And I think as we get older, you realize that it was pretty good. And had we taken it, maybe we wouldn't have had as many missteps in our life. And so the same thing with Morgan, right? If you listen to what she says, and follow kind of the protocols, you will have a much more successful journey with this. Now, let's talk about those side effects. Evan, you mentioned one. You said nausea with the Ozempic. I have heard that with that kind of first generation Ozempics, that was a big deal, right? Like even kind of diarrhea, those types of things, stomach bloating, constipation. It can kind of get you whichever way it wants to, and everybody kind of responds differently. I think the percentage of patients that are having side effects probably lower than what people think, I mean, it's somewhere in that 10 to 15% zone. And so, but luckily I do think that the second generation, the tirzepatides, right, the Mounjaro, Zepbounds, which is what we offer here currently, has fewer side effects like that. So Evan, you didn't have that when you went on tirzepatide or much less, or what happened?
Much less. I mean, maybe the first day or second day.
Yeah.
But
Yeah. And then, I have felt, you get in that scenario before you're kind of ready to maybe bump up to the next number, because this is something that we titrate. And by titration, I mean like you start at a low dose. Morgan's going to start everybody at the same dose. Then she's going to monitor your side effects, check your labs, and then we kind of bump things up. And what I think you kind of notice is right before you get to that shift, obviously they've done all the research in this and Morgan's seen hundreds of patients. So it's like she gets it. It's one of these things where you do feel like, oh man, I'm starting to get hungry at like day 5. You're like, maybe I need to bump up.
We've talked about that. The
medication.
half-life of the drug is, should we be dosing it every week or should it be different? But I mean, that's what the recommendations are now.
Right. All right. So let's talk a little bit about the myths and truths. I'm going to bring Bob Manzo in on some of these just because he's brilliant. He's sitting patiently waiting for us to get him involved. So we'll do that. But the first one is to Evan, right? So this is a myth, right? That the drug GLP-1s melt or age the face, giving you Ozempic Face. So Evan, talk a little bit about Ozempic Face, and then maybe even like what can we do to help manage that? Yeah.
So as we age, we lose fat in our face, and that contributes to the aging face. So same thing with one of the GLP medications. As you lose that subcutaneous fat in your face, you can appear more aged. So I think there's a right way to do this. I mean, if you're losing 20 pounds, I think you may have a little bit of a deflated, appearance, but I think that probably rebounds over time.
Yeah.
But if you're losing 120 pounds, you're going to look
no
more
matter how you
aged
did
in
it,
the face.
right? No matter if you use GLP-1s or bariatric surgery or diet and exercise. I mean, what we've always said is like the slower the better, right?
Right.
But there gets to be a point where if it's so slow, it's self-defeating, and you won't stick with the regimen, or you get kind of down on yourself, and it just doesn't. I don't know. You lose the motivation, right? So I do think that the GLP, whereas like bariatric surgery is kind of crazy. And I will say that bariatric surgery, I've got friends who are really great bariatric surgeons here in Charlotte. But it's one of these things where I don't think they're doing as many surgeries. And so some of them kind of said like 40% fewer surgeries than what they were doing a few years ago. And that's not bad. And, I don't think everybody needs surgery. But it just goes to show you how efficient and how well the GLP-1s are kind of handling things. But I'll also kind of say the joke in plastic surgery, I've said it like, I'm sure Morgan gets so annoyed at me because I say it to like everybody that comes in for a facelift consultation. As I say, the joke is if you never want to have a facelift, starting at the age of 50, gain 5 pounds every year. And you can be like William Shatner, right? Mm-hmm. William Shatner's probably 100 pounds heavier than he was when he was on Star Trek, but that dude looks like he's 19 years old still, right? So just keep plumping it up because Evan's right. We lose that volume. And so it's kind of a weird thing. I don't know if the audience wants to know this, but, they used to, like eyelid surgery, used to be one of those things where people would have some bagginess to their lower eyelids. And they were like, oh my gosh, they've got fatty eyelids. Look at those fat bags. And you were like, no, they're not gaining fat. We followed patients that had epilepsy who were having to get like yearly or every 2-year MRIs. And so it was a great population to follow and to study we controlled for weight gain and weight loss and all those types of things. And we were able to study and actually volumize how much fat they had in their eye bag components. And it was like, we knew it was going down. It was getting less dense. The number was going down. So in eyelid surgery, probably even when you were training, you used to like take that fat out. Mm-hmm. And then we went through this phase where we were like, oh, let's not take it out. Let's morselize it and then lay it across the orbital rim. And that'll and that kind of led to some oil cysts and things like that. And so now I don't remove that much fat in my lower blephs. It's like what I do is I zap the bag that holds the fat and then it kind of tightens it up and makes it look better.
And the same thing with fat grafting and facelifts.
Yep.
Now we do a lot of fat grafting because we understand how that subcutaneous fat makes the face more youthful.
Absolutely. All right, now we're bringing in Bob. Bob, you there?
I am here.
You got to be so bored with me right now, but we've got you in now.
I'm learning.
We've got you in, and the next myth is like right up your wheelhouse, right? So sagging skin is a side effect of the medication, right? Not what the medication does, but the medication causes it. Can you talk a little bit about sagging skin? And then we're going to bring you back in to talk about your ingenious line of skincare and how you're treating this. But talk to us a little bit about that sagging skin.
Can I just give one piece of advice to your listeners, if I may? Can I do that?
Sure.
So I travel the country doing basic research. We have joint ventures with Johnson & Johnson and Amgen in peptide research and basic synthesis of these compounds. So we're really immersed in this. We get this question all the time that when we go to large medical practices and research practices. And the question is this safe? This is a brand new drug and it must be experimental. Your listeners need to know that there's 25 years of solid clinical work done in this area, which has proven efficacy and safety.
Yeah.
People think this just came out of the blue, a few years ago. It has not. And the data out there supports that. And this question comes out again and again. The other question we get is, do you have to stay on it for a lifetime? Well, the data suggests, and there's clinical research to support it, you need to stay on it for a while. It's like anything else.
Yeah.
But that is up to your local expert there in your group to give them the support to continue in the way that's most efficient for them.
Sure.
This is a very individual process. So I just wanted to talk about those things, if that's okay.
Absolutely.
Unless you have comments about it.
Yeah.
We have patients every day who are hesitant to take it because they think it is a new drug and they're concerned about safety for sure.
I think if patients knew, if everybody out there knew just how rigorous our FDA process is, they would feel much more comfortable. I think we have to be the most rigorous governing body of any medical board in the world. I mean, there are things that are experimented on across the world that we're sitting here as physicians and nurses that are like, oh, come on, let us use it. And like the FDA is always, it's almost like they use the rest of the world as the guinea pig, which I guess is helpful to us, but sometimes we feel like we're behind in the technology. But yeah, you're exactly right. This is completely safe. It has been looked at ad nauseum. And obviously there wouldn't be so many different billion-dollar pharmaceutical companies getting involved if they thought that this wasn't here to stay. Bob?
Absolutely. And the cardiovascular benefits, the systemic benefits in the endocrine system of the body are tremendous and well documented. And frankly, a lot of the basic research now is how do we, deploy these drugs for other areas of the body. So it's quite remarkable, the derivatives of the peptides that are going on there. So I just wanted to say that. Yep. In addition, I'm a close to 90-pound weight loss reducer myself on Manjaro.
It's awesome. I mean, you look incredible, man. I mean, you really do. Last time I saw you, you looked 25 years younger, obviously 90 pounds lighter, and just had a different skip to your step, literally,
Yeah, and I can tell you blood pressure, lipids, all the numbers are in there. So if people are wondering, is this bad for me, or is the payoff on taking this worth it? It is absolutely worth it. Yeah. There are clinicals everywhere saying it will, give you a longer life with a much higher quality.
Yeah.
So
and I've got one of my best friends here in town. I mean, she didn't need to lose a pound, right? But like, she went on it. And she will get downright tearful talking to you about how it's changed her life as far as like her joints and her swelling and inflammation, and just how like she couldn't wear rings on her right hand and now she can, and she wouldn't dare wear high heels or stilettos. She knew in 30 minutes she was going to be in excruciating pain, and there's just so many avenues that these medications are improving people's lives. I mean, kidney protection they're using it for anxiety and ADHD, but I'm going to get us back on track here. Let's talk about the sagging skin. Tell me what happens, why the skin actually sags with the weight loss that comes from GLP-1, right? Directly, that peptide does not cause any problems in your skin, correct?
Yeah, the peptide itself is not a causal relationship to any of the sagging skin. It's the volume loss. Dr. Zoog was very articulate about his analysis of it. So what we advise patients to do is, if they're considering it, going on GLP-1, is to start with, and it's funny, but we use peptides in topical applications to work with the peptides that you are injecting or dosing in some way.
Sure.
And so our peptides actually seek a receptor for collagen and elastin synthesis. So the more collagen and elastin that your body makes, the better your skin will be. And so while you're losing some volume from muscle and fat, you can regain it over time with the use of these things. So,
and this is a topical application, right? So like for this is a skincare cream or application or something, because I will say that I just want people, while everyone needs to, and Morgan can kind of talk about, using protein, increasing protein in your diet and doing stuff like that. I don't personally recommend, I think it's kind of hogwash to tell people to do these collagen shakes and all that kind of stuff.
It's been proven to be false. When it goes into the stomach, it's hydrolyzed, and when it's hydrolyzed, it's cleaved and it's ineffective.
You're
absolutely right.
Yeah, so it's great that you've got a preparation that can go directly on the skin, which is awesome.
Right.
All right, I'm going to ask Morgan, right, about hair loss. So hair loss is a direct, permanent side effect of the GLP-1 medications. That's the myth. That's what people say. What's the truth?
So I feel like a lot of women that are interested in these medications are worried about that. No woman wants to lose hair.
No man does either.
Well, true, but women for sure.
Don't you look at me like it's not me too. Don't you say that.
Women for sure are worried about their hair. That's always the first thing that they say in consults. Losing your hair is not a direct cause of the GLP-1 medication.
Right.
It's actually anytime you lose weight, that is a stress on your body, whether you're doing that with GLP-1 medications or you're doing it through diet, exercise.
Yeah.
That's going to cause stress in your body, which in turn is going to cause you to lose hair.
Now, is it permanent?
It's not permanent.
Okay.
And what I would always recommend to patients, if you're worried about that, let's be proactive. You know, we have supplements, Nutrafol and Obagi has a hair serum that we can increase the growth of the hair that you currently have, so that if your body undergoes that stress or you lose any hair, you're already prepared for it.
And the really cool thing is that, you know, you got together with Debbie and Carla and myself, and we talked about like how we could kind of combat these things. And if people are really worried about this, because we offer, you know, hair solutions here, right? Like hair
PDGI,
rejuvenations, sure, PRP injections and all those different things. And so when you're on one of Morgan's programs, right, like we don't want you to do a month-to-month thing. Like we'll talk about the subscription a little bit in a second, but we want to make sure that patients are doing this, you know, for the appropriate amount of time so that they can truly get the benefit. And when you sign up for those things, you know, things like your skin needing some tightening, whether that's RF microneedling or doing skin hair removal or hair rejuvenation, those things. Like when you're part of the program here, you get a percentage off of those treatments, you know, which is super neat too. All right, so the hair loss is it kind of kicks your hair into the phase where you lose it, because we're constantly shedding hair and growing hair, and your hair's going through different phases. So it just shifts you into that phase where your hair may shed, and then it comes back.
It comes back for sure. And another thing I'll add to that too is that nutrition plays a huge role in hair growth and your collagen and everything really, which obviously these medications are suppressing our appetite. So it's huge to make sure we're getting in all the nutrients that we need. Protein is huge.
Yeah, a lot of it's protein. Yeah, you're right. Yeah. And so, okay. And then, Evan, talk to me about, we've talked about Ozempic Face, right? Talk to me a little bit about the Ozempic Butt.
Mm-hmm.
Like what's Ozempic Butt?
Yes, same thing, same concept.
Like the
right?
leaky butt when you used to eat those potato chips with Olestra in it? That's not what that is, I hope, right?
I hope not.
All right, what's Ozempic Butt?
So people may be surprised to know that the buttocks, a large portion of the shape of the buttock and the volume is the muscle.
Right.
So what does that tell me about these GLP-1s is you're losing a lot of muscle when you take it, if you don't do it correctly.
That's right. Yeah.
And so a lot of women don't eat a lot of protein, and they have that side effect. And so it's super important to have a good diet when you're on one of the GLP-1s, eat a lot of protein and exercise.
Huge.
And we also talk about like weight training. You know what I mean? Like resistance training is super important. People who are taking GLP-1s and are just going to walk for forever, that's probably not what you want. And then, you know, and like watching what you eat and having a rice cake and a cup of coffee, it's probably not what you need, right?
You have to weight train. You have to resistance train, especially as women, and especially if you're on a GLP-1.
Yeah, and so how much protein are you telling people to consume daily?
So I typically am saying 100 grams to 120 grams just as a generic range.
Sure.
But, you know, if you want to be really specific and dial in, I would say 1 gram to every pound that you weigh.
Yeah, and so something that's helped me is that there's actually like meal programs, and you can get 55, 60 grams of protein out of one of these like little pre-prepared lunches or dinners or however you want to do it. It's really, really amazing. And then there's a really good Fairlife chocolate
protein shake.
Protein shake that's like 30 grams right as is.
And usually I say if you can hit at least 30 grams in breakfast, lunch, dinner, then that's 90, and then fill in the gap. So
and then your butt and your legs are like your biggest muscle group in your body. So it's, you know, you got to work that out, right? And so those are areas where, you know, a personal trainer, and we've, Morgan can connect you with several that we think are fantastic that we've kind of partnered with, will help you and guide you so that you're not losing muscle mass. And she also has, you know, a smart scale that we use. And so we'll be able to map your body's composition throughout this whole process. So, I mean, if you start to see that, oh my gosh, I'm losing muscle mass, because it's great to lose weight. Awesome. Scale looks awesome. But if you're losing all of that in muscle, it ain't worth it.
That's right.
You know? All right. Now, this is where we're going to bring Bob in on like We're going to have to take a knee because he's going to get super smart on us right here. All right. We're going to talk about the intelligent skincare solutions that Skinprint has come up with. And just so everybody knows, Bob Manzo and Bob Graper, the late, great Bob Graper, not that he's dead, but he did quit on us. I mean, retire. He retired. He didn't quit. I got to quit saying quit. They have been buddies for forever. And Bob Graper, I think, is one of the most forward-thinking plastic surgeons I've ever met. He also demands science, which is phenomenal. And I'm so thankful that he mentored and taught me the importance of that. And so when you got him geeking out on science and Bob Manzo geeking out on science, it was like a college professor lectureship. I mean, it was unbelievable. So Bob has several businesses. The one that we partnered with first was Skinprint, that I have used, my wife has used, I think my kids use. And so Bob, tell us a little bit about what your company has done to specifically direct formulas for the GLP-1 patient.
Sure. Thanks for the opportunity. We have developed a line of products, actually, excuse me, that work synergistically with this type of weight loss. So in the skin, there's you think of it as if you took the skin and there's two general layers, a top layer and a middle or bottom layer. The top layer, consider as the mattress. The bottom layer, consider it a box spring, for instance, for an analogy or a metaphor. So the mattress needs to maintain that cushiness so that you get that soft feel. And the lower skin surface is the box spring, which gives you structure.
Sure.
So you have collagen, which is in the top to give you springiness, and then elastin in the bottom. And so from a chemist standpoint, this is a rich field because peptides that we use will target a cell that's in your skin called a fibroblast. It sounds like a big word, but all that means it's a manufacturing center for the skin. So this little cell makes lipids, it makes collagen, it makes elastin. Well, how does it make it? It makes it upon a receptor seeing a peptide that comes in. So we formulate products with peptides that initiate collagen production. And you all know, I think, that there's many types of collagen, 10, 20, 30 different types of collagen. We can literally initiate what collagen we want in skin and then what elastin we want. And we use ultrasound, and we will look through the skin surface to see how we're building that lower, mid, and top section of the skin. And we've developed a line that is perfect for this process for your patients.
Wow. So it's basically like you're using formulas, medications, right? Compounds that are signaling the cells to ramp up their production of collagen and elastin to improve the skin. It's like it's relaying messages to the cell, right?
Exactly.
That's
exactly
awesome.
What it is.
That's awesome. So this is specifically, right? I want to call it a name. They're called BIO-SCULPT Firming Products, right?
That's correct.
All right. And so do I just use this on my face, Bob? What areas of the body can I use this on?
So we have one or two for the face, and then for the neck, we have a separate series, and then for the body, we have another series. So for the body, it's a bit more difficult. So we have a lot of creping and loss of of volume in the abdomen, for instance, in the back of the arm, the tricep areas, neck, and so on. So we've developed these products such that we're targeting, particularly for the abdominal area, a lot of elastin, which gives structure and keeps that further up rather than falling down than it would have without using these products.
And the smart thing is you can approach the skin in any area of the body, right? From a multifaceted approach, right? It doesn't just have to be laser treatments or microneedling. It's like the combination of doing, say Morpheus radiofrequency microneedling to your skin, along with using the BIO-SCULPT firming products. I mean, that's like a synergistic kind of relationship. I also tell people when you use the BIO-SCULPT firming products, you're basically protecting your investment, right? Because, aesthetic cosmetic procedures aren't cheap, but you want to maintain them as long as you can. It's like we tell people, you can't just go get, laser treatment to your face and then not take care of your face with, skincare regimens, sunscreens and things like that. Like there's upkeep to them. And so and our skin is continuing to turn over, right? So if we're giving it the proper nutrients and in your scenario, the proper cell signaling compounds, then we can maintain skin that has a better level of collagen, a better level of elastin, even healthier collagen and elastin to improve and maintain the results that they get from some of our procedures, right?
Absolutely. And what you said there was really important for your patients to know. You have in your facility these multimodal types of systems. So let's take, if they're starting the process, they'll start with, let's say, with a peptide that you're using. At the same time, they should be using these topicals to stimulate collagen elastin. But what's even better, if they go on a series of these laser treatments like Morpheus or RF microneedling, what that also provides is an instantaneous heat reaction within the dermal tissue, and heat is producing an injury effect, and the body sees injury effect by trying to heal and sends up healing cytokines, which are proteins, which really help to generate new collagen and new elastin in that area. So what you said was perfectly true, and this is what your staff does so well, is it combines these things so your patients get a better result overall and maintain it.
Yeah, well, and you make it pretty easy when we partner with people as smart as you that actually have I don't think I've ever even asked you, Bob. I don't know which came first, the chicken or the egg. I don't know if the BIO-SCULPT Firming Products and this kind of idea came out of your own personal experience, or if this was kind of already being formulated before you personally went through your weight loss journey.
It's a really good question. So we were deep in research and fine line and wrinkles because it's an aesthetic thing. But when I started losing, I knew one thing, and it's Morgan, right?
Yes.
Yeah, Morgan, you're exactly right in everything you said. And one of the things that I was advised to is do some weight training. And so I went a little overboard in weight training, but my muscle volume increased dramatically, which mitigated a lot of these things. And so having that knowledge that Morgan has, in addition to all the other services that you provide, I mean, I don't know what a patient could want more of, honestly.
Yeah, that's awesome. I can tell you, and I speak from experience, my wife will tell you that I have not gone wild on the weight training. So next time you come in town, and I think we're going to dinner in a couple of weeks, just don't tell her how much you're working out, because she looks at me now and she thinks that I'm going to get sand kicked on me when we go to the beach next or something like that, right? Losing muscle, but I'm going to work on that. I'm going to work on that. Okay, so obviously from a surgical standpoint, we know that what Morgan's telling you to do from a high protein diet, preventative things, building your muscle up, and from what Bob can do with his skincare line in helping the actual skin improve its quality, Evan and I come in when it's a quantity issue, right? And so if you've done all those things, and some people we just know, like Evan kind of mentioned it earlier, if you're going to lose 20 pounds, you may not need Evan and I. You probably don't need Evan and I. I mean, you may need it if you're a perfectionist and you really need, something done. But that degree, if you start with the things while you're losing the weight, and that's part of the key component to this, right? Don't just wait until you're done and then show up and be like, I got loose skin underneath my neck. It's like, all right, man, well, we should have been treating this the whole time. You're going to need us if you're going to lose 120, 180 pounds. Like that's a different ball game. And so that's kind of when Morgan, after following you and seeing you, will be able to kind of say, hey, you know what, I think it's time to go see Dr. Zoog or Dr. Harper and let them evaluate how they can really, really kind of clean this up and just make you feeling even that much better. Because, the number of patients that come after massive weight loss, not just from GLP-1s, because, Evan and I have been operating on people before GLP-1s were a thing. The ones that come after massive weight loss, I mean, they've done such amazing work losing that weight. It's like, it's incredible to be a part of their journey. But I mean, they are really, really kind of hung up on their excess skin. And so to help them through that journey, to help anybody through that journey is, it's just really an honor. I mean, it's just, it's great to be a part of that whole thing. Morgan, I want to talk a little bit. We mentioned it very, very briefly. But, we've got our own integrative weight loss management program. So just tell me kind of what happens when somebody calls up and says, hey, I listened to the podcast and I'm interested in losing some weight with Morgan. What happens? Like tell them kind of the scenario from the phone call to when they're injecting.
Sure. So I always have people come in for a consult. I like to get to know you, know what your goals are, tell you about our program, what we offer here. We do offer the tirzepatide, but I like to go more in depth with talking about the InBody scale that we have, how I can help you with the workout, nutrition aspect, things like that. So that first appointment is just truly a consult, getting to know each other. And then I send in lab orders and get you to go to a LabCorp locally or wherever you are so that we can review those labs.
Okay. So you do labs before you start injecting?
Yes. So we do labs before we start the program fully, but before you start the tirzepatide. Just like to check your hemoglobin A1C, insulin levels, look at the thyroid. Lipid levels have been really interesting too, because like you said, just watching those and then after 6 months, seeing if they are trending down, which is really cool.
Yeah. I think Bob said that happened with him.
Yeah. Actually, it's happened with quite a few patients, I feel like. So just another benefit of the medication. And then after we get the labs, we kind of get you started and we do monthly check-ins depending on what program you sign up for. So we offer 3 months, 6 months, depending on what your goals are. I kind of help you make the choice on what is the best option for you.
And what if I'm just like, because you do the injections, right? I know you also offer the oral, but not a lot of people are taking that, right?
Yeah. I just feel like we've had most success with the injections.
Okay.
And
injections are how often?
Once a week.
All right. And let's say I freak out at needles.
That's totally fine. You can come see me once a week and I'll do your injection.
Oh, you're nice.
Yeah.
I don't freak out at needles.
Some people do, though. I do have a few patients that come weekly, and it takes 5 minutes.
It's always the person with a lot of tattoos like me that have problems with needles, right?
Always.
I know. Martin, our anesthetist, loves that. He always loves it when people are freaking out about getting an IV started and they've got a full sleeve tattoo. He really loves that. Okay, all right. So then you start injecting, and then how long am I on that first kind of, I think 2.5 milligrams is the first kind of dosing. So how long am I on that?
So for 4 weeks, I start everyone at 2.5, and then you come in after 4 weeks. We get on the scale and see how your progress is. I really like to look at that muscle mass.
Go over their side effect profile, all that.
Side effects and everything, really. And if you're having a lot of side effects, we can bump off of that 2.5. And if you're making progress, you've had more progress than what we expected, we could stay.
Yeah. So you can tailor it. You can decide exactly how much you want to do.
It's very individualized based on the patient. So
that's awesome. That's awesome. Okay. And so then how often are they getting repeat labs to make sure nothing's wrong?
With our program, we're repeating labs every 6 months.
Okay.
Yeah.
Perfect. And then along with our program, I mentioned it briefly. Obviously, we want to combat things like being worried about hair loss and stuff like that, and kind of address it before it becomes an issue, or at least offer therapies and treatments to patients at a discounted rate if they're part of your program. So we've got 3 different Fit Fabulous programs. You can tell that I didn't name these, but Fit Fabulous programs. Tell us about the Jumpstart and let us know, the longer the program you choose, like if you're on the 3-month or the 6-month for Morgan, you'll get more of a savings on the different treatments.
Yeah, on those add-on packages.
Yeah, so the add-on packages are the Morpheus 8, which is the radiofrequency microneedling, laser hair reduction, which Morgan also does, so that's great. You just kind of stay with the same provider. And then hair restoration, right, with PRP, PDGF, Nutrafol. Like you said, there's new Obagi serum that works for hair restoration. I'm sure if Skinprint doesn't have one, they will. Bob, do you do anything for hair loss?
It's coming. So
I knew it would be. I knew you wouldn't leave that one alone. All right. Well, great. Well, listen, call for a complimentary consultation to discuss your goals, find out more about the integrative weight loss management and follow-up solutions at GHCS. Visit our website, ghsurgery.com, or even give us a call. Our gals up front are super knowledgeable. Or if you want to chat with Morgan about these things, she can certainly go over things over the phone with you to make you feel more comfortable. But hopefully, listening to the podcasts are informative, educational, and you kind of get to see that this is a total integrative approach. We're not only using the GLP-1 technology, but we're using technology that, folks like Bob Manzo and his skincare line are literally coming up with and formulating compounds specifically for these patients to combat these issues. And Bob, I got to commend you. It's I've never seen anyone that is more enthusiastic really about anything, but certainly about skin than you are. You are a true kind of chemist by background and just a true scientist. And I think that your friendship and relationship with Bob Graper has trickled down certainly to myself and Dr. Zoog. And we can't thank you enough for the partnership that you've had with us for a decade. Jeez, it's been a while, man.
It's been a while, but it's much appreciated, and I've learned as much as you have. So
I know you just lied right then. Yeah, your nose is growing right now. But, we'll talk about future trends, and we'll learn more as these things kind of come out. We mentioned a little bit about how new medications are coming, and Bob's obviously going to have something for hair growth, so just be on the lookout for that. But as we head out of here, we want you to know that your voice matters to us. If this episode sparked a question or if you have a topic suggestion for a future episode of the Doc Dudes, don't hold back. You can easily reach us through ghsurgery.com. Just click the dedicated Doc Dudes link on the homepage to submit your question or comment. Make sure you're subscribed on Apple Podcasts, Spotify, iHeartRadio, or wherever you listen to your favorite podcasts so we pop up automatically. Remember, we drop fresh episodes on the last Tuesday of every month. Lastly, keep up with everything happening at our practice and get episode updates by following our Instagram and Facebook pages. This is Dr. Garrett Harper and
Dr. Evon Zoog
and Morgan Alexander
and Bob Manzo.
All right. Take care. Thanks, guys.